Namaste, Salam Alaikum. I am Maitreyee, a patient advocate with SAIA, South Asian IBD Alliance. I live in India. On today's Gastro Gyan SAIA Ask the Expert series, we are going to talk about deeply important topic that's mental and emotional well-being by living with IBD, and especially in South Asian communities and families. We are so glad to have Dr. Ali Navidi with us today. He really understands the intersection of IBD and mental health. Dr. Ali, would you like to introduce yourself quickly before we jump into the questions?
Sure thing. Thank you. And it's good to be talking with you today. I'm a clinical psychologist. I'm in the DC area in Northern Virginia, and I've been working with patients with GI difficulties for maybe about 14 years. And recently, about 5 years ago, started a bigger practice because I felt like there was such a lack of GI-informed care in the mental health space. So I started a larger practice called GI Psychology, and we're here to support patients with GI problems all over the United States. So I'm happy to talk with you today. How would you like to start? Do you have any questions?
Yeah, sure. I will start with my personal experiences. Speaking for myself, it was really emotionally draining and challenging to open up because the responses was always like, "Don't be a drama queen, keep it in the family," and those silences really broke me, right? And yes, they always say, "Keep smiling, and it will get better soon." So yeah, having IBD is emotionally draining, and in South Asian communities, we are often told to dismiss our feelings or keep it in the families to avoid potential embarrassment or sometimes conflicts also. So, what advice will you give your patients experiencing this?
Yes. So this is a very challenging and difficult topic. First off, family is so important, and the connections with family are so important that we must maintain those connections and make sure that they're healthy and supportive while at the same time getting the treatment that we need, in terms of mental health. So how do we balance that? I would say there's probably 4 phases that I would guide a patient through if they were my patient, right? The first thing is to seek that help first and without necessarily reaching out to the family, and to work on our own skills in terms of building tools to help ourselves manage our feelings, our anxiety, our depression. And then once we've developed some of those skills, then to spend a little time and understanding our own stigma around mental health, because until we work on ourselves, we can't really go out and help convince other people, right? Then I would say to find allies in the family, people who are going to be a little bit more open-minded about it so that you can explain it to them in a way that they can understand. Because you use some really key words there: drama queen, right? Keep it in the family. And these are big frames that people are looking at mental health that keep people from getting help. Drama queen implies that mental health is just about getting attention for yourself, right? And so that's the first step, is you want to reframe that in a new way to the people that you care about, and being very strategic in who you reach out to first, right? So that they can see that instead of a cry for attention, mental health is about getting stronger, because there is a tremendous connection between our mind and our body. And that if we don't take care of the mind, then we won't be taking care of our body. And so doing everything we can to be healthy means having a healthy mind also. So I would try to reframe that so that people understand that mental health isn't about drama, it's about mind and body health. And so that's an important part. And then the other reframe would be about keeping it in the family, because I think a lot of people perceive therapy as airing dirty laundry, right? So you're telling the family secrets, you're complaining about people. And that is not what's going to be happening in therapy. What's happening in therapy is you're learning skills and you're learning tools so that you can have a healthier mind, so that you can have a healthier body, so that you can live a healthier life. And of course, who wouldn't want that, right? So you could see we're reframing these beliefs, and I would start to do that with strategic allies.
You so much for reframing all the things and the phases. I loved the phases. So yeah, uh, speaking about cultures, there is the timeline. We have to complete those things like getting married, having a stable job, having babies,
Yeah.
and the list goes on. And in our cultures, we come from the cultures in which there are high expectations to succeed in every aspect of life.
Yeah.
There is this unspoken timeline to accomplish that also, and IBD often disrupts that flow. So, leaving so many us feeling behind. What can people do to overcome those feelings and expectations?
Yeah. Again, this is a difficult subject. You're not giving me any easy questions here. Um, I would say that you can um, reinforce what they're saying. You say, look, I agree that these are important. I agree that family is important. I agree that marriage is important. I agree that career is important. But I think we all agree that it needs to be done at the right time, meaning you wouldn't send a first grader to college, right? You wouldn't you wouldn't have someone who's 5 years old get married. Things need to happen at the right time. And that time is right for different people. People are ready for certain things at different points in their life. You can't line everyone up and then make them all fit on the same timeline. If you try to do that, you're going to end up with failure. And as a family, we don't want failure, do we? We want success. So I agree that all the things you're saying are important, and we need to make sure we're doing them when we're ready. And chronic illness changes when we're going to be ready. It doesn't mean those things aren't important. It just changes when they can happen because you have to be ready for, like, if you're not ready for marriage and someone, forces you into a marriage, that marriage is more likely not going to be as successful. So we want success. So we need to be mindful of when we're ready for things.
Thank you for saying the timeline is different for everyone. That's really hit home. Yeah. So, and honestly speaking, it took me a long time to realize my mental health was affected and lot of
Mm.
outbursts also. So, yeah, even then I was bit hesitant to ask for help because of the stigma and little lack of access also. In my context in India, we don't have so many psychologists or therapists who understand the IBD and the unique challenges of IBD patients. So, seeking mental health care is extremely stigmatized in our cultures, and access to adequate care is a barrier. What are some practical ways people can manage their mental and emotional well-being while living with IBD in South Asian communities?
Yeah. So I think, you know, even in the United States, access is a problem for therapists familiar with IBD patients. That's literally why I created the practice that I did. GI psychology was born out of tremendous need. What we found is that patients with IBD could not find mental health care that was IBD informed, that was GI informed. And so I created, myself and another partner created this practice to support patients all across the United States in all 50 states. We're a telehealth practice. We've got about, I think, 15 clinicians that are trained, specifically trained by me, to be educated in brain gut therapy. We use empirically based treatments, cognitive behavioral therapy, clinical hypnosis. I would say for people where that's a serious problem and they need to try to access care to some extent on their own. Um, I would look for opportunities to do at least two minimal things. What, right? The first would be to find places where you could learn the skills of affect regulation. So these are the skills, the ability to calm ourselves down. It's like kind of a core skill that if we don't have it, we almost can't learn any other mental health related skill. And whether that means meditation, whether that means breathing techniques, whether that means visualization, whether that means clinical hypnosis. There's a lot of areas that you can learn these skills to calm yourself down, but to pick one that agrees with you and to really learn how to do it well. That would be kind of a minimum. And then the other is to find a community like SAIA, right? Find a place where you can connect with and talk with other people who are having the same struggles. And make sure it's a place that is positive, doesn't have kind of a toxic air to it, right?
Right. Thank you for bringing up the community importance. We know that SAIA and IBD disease has been helping so many patients to help them manage IBD and also mental well-being. Thank you so much, Dr. Ali, for sharing your insights and your heart with us today. These conversations are really important. And to everyone watching this, we hope you felt seen, little less alone, and supported after watching this. Thank you so much, and keep watching for many more SAIA Ask the Expert Gastro Gyan series episodes. Thank you so much.